She Can, we lead with women's stories. We have women who lead by example, and we interview women from all over the world and all kinds of different areas. And I'm really excited to talk to Komel Caruso today. Komel, welcome to She Can. You're the co-founder and chief operating officer of HerMD. And with HerMD, you're revolutionizing the future of women's healthcare through an integrated evidence-based model delivering comprehensive women's healthcare. You do that virtually, and you also have some in-person clinics around the US. You are a physician-founded, patient-driven, mission-driven, patient-forward company operating in women's health. We would love for you to tell us in your own words what you're doing. You have a lot of success. You've raised quite a large amount of money, which we're going to talk about later. And you deliver the care that you feel women deserve, which is amazing. We want HerMD on every street corner. Tell us a bit more about your journey.
Sure. And thank you so much for having me here, Stephanie. I do really love talking about HerMD's story, my own personal journey. And the founding of HerMD, just for a little background, is because growing up, we saw our own mother dismissed by the healthcare system. And
Mm.
so she nearly died. She's alive and well to this day and actually celebrated her 50th wedding anniversary yesterday with our father, which is pretty amazing. But she was in Cleveland, Ohio, which is, the Mecca of cardiology. People come
Mm.
there to take care of their heart issues. And she had been complaining at the young age of 44 of left arm pain, chest pain, shortness of breath, and she was repeatedly sent home. They said it was stress, it was anxiety, her children were stressing her out. And, I did normal teenage things, but I wasn't, such a stressful child. And she was sent home for months and months, despite those symptoms and despite a strong, strong family history where multiple family members had died of cardiovascular disease. And so one day she was rushed emergently to the hospital and she ended up having emergent quadruple bypass surgery. And I was 15 at the time. And my sister, who is one of our co-founders as well, she's a board certified OBGYN. She decided she was going to go into women's healthcare. And so I decided after, years in my career in education and marketing and sales that I was going to join her on that journey because we did not want women to be dismissed, to be ignored by the healthcare system anymore. And we saw this large gap in the healthcare system where women who were perimenopausal, menopausal, experienced sexual dysfunction were really just ignored and kind of put aside and said, this is just a part of life and you have to deal with it. And we said women deserve better. They deserve a space where they'll be heard, where they will be listened to, and where their symptoms will be acknowledged, and they would be given evidence-based solutions to help them manage, their menopause and sexual dysfunction.
Mel, which is so inspiring. We all have a personal story, I'm sure. I've got various to list, and I think that's why it's so important to have something of the service that you offer. It's a very under-researched and underfunded area, still women's health. And so tell us a little bit more about the sides of the business that you're responsible for. Your vision is the overseeing operations, marketing, brand, product. You're the creator of HerMD's patient-centric experience. Tell us more about those big visions that you have had that and you're putting them into practice and how you're putting
Yeah.
them into practice.
Yes. So when we raised our first $10 million, the first 10, that was getting us ready to scale. And so what we knew we had to do was really focus on the patient experience because, as you had said, you know, it's very underfunded, it's under-researched, and women didn't have spaces where they felt safe and comfortable. And
Mm.
so that patient experience is really core to what we do at HerMD because you're talking about such intimate issues and intimate problems, and many times you've been ignored for years by your primary care provider or your GYN. And we wanted a space to create a space where women felt comfortable. And so it's a multifaceted approach to the patient experience that we really took to heart very, very seriously. So every touch point, we call it the HerMD magic. We want patients to feel magic because they come to us often so very distraught. And so from the moment they walk into a HerMD location, they can feel that magic. So the space has been designed with them in mind. So soft lighting, beautiful furniture. Our care team is trained to work with these patients. And so Dr. Javed, my sister as well, she's one of our co-founders, she developed our proprietary algorithms of care, which we call HerMD University. So all of our providers also go through extensive training to really be able to take care of our patients who come to us for menopause and sexual health. And so that guarantees that they get the same care, the care that they deserve in every location, and the same remarkable outcomes that we have data on that we present at major medical conferences to show that the way we care for patients and how we've developed these care protocols are really leading to better outcomes for patients. So they're feeling better. We're changing their lives. We quite honestly, if you read our reviews, they're pretty remarkable. And that's why we do what we do every day, because we want patients to walk out feeling that, they're empowered to take control back of their health and be a partner in their care. And so it really is that holistic approach of really thinking through every touch point to make sure they feel good.
Komel, I love everything you said, and how amazing is that? And I'm wondering, why isn't there more people around the world who do what you do?
Right.
Can you describe to us a little bit your leadership style? I mean, this is you and your sister and a few others. How do you make sure that, I mean, you discussed how you make sure that the same level of care is provided in all the different locations. You also do some virtual care, right? So people can go in person, they can do it virtually. Um,
Right.
Tell us a bit more about that leadership style and that beautiful brand that you've set up, and how does it trickle down?
Yes, so at the core of our brand is the patient, but it's also our providers, our care team, and everyone who works at HerMD, because we are just, two women who started this company, and we've brought along nearly 80 plus people along our journey. And we feel so very privileged to be able to work alongside everyone who's joined us. And so, in terms of leadership, we lead with our mission and we want to inspire people. So, my leadership style, I want to inspire and I want people to grow and feel empowered also, just like we want our patients to feel empowered. And so, when I'm working with the team, we really want them to come up with their ideas, bring them to the table, because they're with patients. The vast majority of our team, they're involved in patient care. And so they're in the rooms every day, in and out, caring for them. And so they know, what women are saying, what women are feeling. And so we want that feedback from them so that we can then incorporate that into our website, into our communications, into our educational events. And so it's important for me that the team feel empowered, that they know that there's a deep level of trust, that we're all in this together and that we're working together to push this mission forward because it's bigger than any one of us. And together, I always say, when we work together, all the ships will rise because there's so many women. There'll be 1.1 billion women in menopause in 2025 globally. And so together is how we're going to make that change. And so I think our entire team just feels so inspired and empowered by that we come every day with a vision of changing women's lives.
Comelin, it's really palpable how you are on our side. And I love that. And I don't think that's the typical experience of a woman when she experiences health challenges and goes to the doctor. So you talked about it. You raised 40 million to date, which is an incredible amount, that allowed you to scale and scale towards that big vision you have. And we're going to talk about the vision later. But tell us a bit more about that journey. How did you raise the 40 million? How was your experience? And maybe is there any advice you would give to other female founders? We have so little of the pie of investment given. And so I think that's really important to talk about.
Yes, yes, women get less than 2% of all VC funding. And then when you take into account, there are three founders, we're all minority women, which we're very proud of. And for entrepreneurs, we're also a little bit of dinosaurs. We're all in our 40s. And so we were told we had less than a 1% chance of raising any kind of money. But we were very positive in our mission. And so through the fundraising process, the first 10 million, I'm not going to say it was easy, but it did come more quickly than we had anticipated. So we were able to raise that within a few months, I think with the story and with the data. And we had our first location open, so we were able to show a proof of concept. But, we were very particular about, how we were going to manage that fundraising process. So we did a lot of research. So we researched healthcare investors, ones that were interested in the women's healthcare space. There were some that were investing in companies that were focused on women's midlife health, which I'm not the biggest fan of saying women's midlife health, but we had to target those investors pretty specifically to make sure there was that interest. So that's, a very good tip to give is that you do your research and you find the partners who are going to be with you and share that same vision. Because we want to raise the money, yes, but you want to raise it with the right partner who sees your vision, who will be your partner to move it forward. And so we were fortunate to find some wonderful partners to invest in us and help us grow and scale the model. And so, I think the other thing is you have to believe in yourself. And oftentimes we don't, even though we're successful, there's imposter syndrome. There's, wanting to raise money in such few dollars, going to female founders that often it seems the cards are stacked against us. But I think, that belief in yourself, it sounds so simple, but we oftentimes fail ourselves from that respect. And so, no one knows your business better than you. At the end of the day, you're in the business every day. You're talking with your patients or customers every day, and you have that vision for the brand and what you want to bring to the table. And so finding those partners who believe in that alongside of you is really key.
Komel, do they give you funding, obviously? What else do they give you? In which other ways are they helpful to you? You were talking about how you chose them so carefully. What else do they bring to the table that you really need and appreciate and would advise others to look out for?
Yeah, so being a physician-founded company, it was really important for us. We're patient-driven. We take insurance, which is the more difficult route to go here in the US. A lot of people
Yeah.
said you could go cash or concierge, but access to care was so very important to us. And so that is why we do take insurance, because we want as many people possible to take advantage of this care they so rightly deserve. And so the investors that we went with had deep healthcare expertise. One of their founding team members is a physician himself, so understands the healthcare system and what's broken, not only for patients, but also for providers, because
Mhm.
providers are burnt out and they are trying to do the very best that they can with the limited time that they have. And so having that physician also understanding the broken healthcare system and patients need more time. And so HerMD, our patients get 20 to 40 minutes with their provider. And so that was important to us. And then also with that deep healthcare expertise, navigating the insurance system
Mhm.
was going to be challenging, and we knew that. So we identified those challenges early to make sure that we had partners who could help us, navigate that. Because in the US, we have to negotiate insurance reimbursement rates in every state. all
Wow.
over again. So it's not you have one national contract,
Mm.
especially when you're a small startup and you go into another state and they say, okay, you can just, be on this insurance plan and everything's good to go. There's a lot of work behind that. And so making sure you identify those areas where you are challenged because you can't do everything. Oftentimes, as a founder, you feel you can do everything and you need to know everything. And you can't. You're a human at the end of the day as well. And we often forget that. And so bringing on partners and identifying those gaps where they can really support you and offer resources, knowledge, experience is really key.
Yeah. Komel, so you've been talking about the challenges. What are the major challenges that you face in scaling further and a little bit the vision of how to overcome them?
Yes, so a lot of the challenges are quite honestly, yes, with insurance reimbursements. And then also, we have many providers who want to join HerMD, but there's such a profound lack of providers who are trained in menopause and sexual health care. And so the education system here for providers, unfortunately, is failing them because they get such little training on menopause and sexual health care, if any,
Yeah.
through medical school and residency. And so that was a challenge in terms of making sure that, the provider pipeline is full, they desire to work here, making sure that they're trained. So, and then also, I would say, operations and scaling clinics and making sure everyone is trained the
Mm.
way that we want them to be trained to deliver the care model that we want to deliver to patients. And so, really making sure that operationally we have very strong leaders who can go to each of our locations and train our team, make sure everything is set up appropriately. That's challenging and that takes some time as a founder and as an entrepreneur. You want to keep going and grow fast, and there's not enough HerMDs out there. We want to get this in every state, on every street corner, and women deserve this. And so when you're out there, you feel that patients are, almost desperate. Like, we want you, why aren't you here? And we want to make sure that we're doing things appropriately and setting ourselves up for success so then we can massively scale. And so it takes a little bit of patience sometimes, which we often, at least I don't, I've found myself, I don't have sometimes when you're a founder because you want to take that mission to so many more people.
Yeah. Yeah, which is beautiful, but a challenge in itself.
Yes.
Kumail, I love what you said because I just think that as women, especially in the sort of midlife point, you have
Mhm.
so much to take care of, and you have it, if you have it under one roof, it's so much easier. We have to check the hormones, we have to do the mammograms, there is so much to take care of, and it could take up a lot of time to
Mhm.
just tick the boxes and do the bare minimum. So I love the concept of having it all under one roof. Komel, so I'm wondering, you really are a women's health advocate. You have a lot of data. You know really how to look after your own health, I'm sure, in the best way. Can you give some advice to our listeners on how we as women can champion the best way for our own health and well-being?
That's a great question. I'm a preacher and I must, sometimes I feel like I fail what I preach sometimes, but I do try and take good care of myself. And I fortunately have access to great providers. But the first thing is to really become educated. And, there's a lot of great resources out there. And unfortunately, there's some not great resources out there. And so to find the right education and really advocate for yourself, that's the most important thing because right now there isn't a HerMD on every corner or in every state. That is the goal eventually to scale nationally and then, globally would be fantastic. And so the healthcare system unfortunately requires us to be our own best advocate because as women, we also know our bodies better than anyone else. And so if something is wrong and you feel it and you know it, and a provider is telling you, no, you're fine. Our patients have been told, just drink wine, you'll be fine. Or, this is a part of your life. You kind of just have to deal with it. You need to find another provider because, there are over 34 symptoms head to toe for menopause. 43% of women experience some kind of sexual dysfunction, whether it's pain or issues with libido or orgasm or arousal. And we shouldn't be embarrassed to talk about those things. If you're healthy sexually, it has so many other health benefits. And menopause, we'll spend maybe approximately 40% of our lives in some kind of menopausal state between perimenopause, menopause, and then post-menopause. You're still living in that estrogen deficiency and you can still experience symptoms. And so we tell our patients and we tell the women who come to our events that get educated, go to these events, follow, physicians who are trained online, find your tribe and your community to be able to talk openly about what you're facing and not hide your symptoms in, shame and stigma. And then if your provider isn't listening to you, absolutely find someone who will.
Komel, I'm so thankful that you say that because I've had a harrowing 8 year journey through menopause that really derailed me. And only after 8 years did I find a physician who actually got to the bottom of it and has tools and choices and opportunities to make things better. Um, so you're committed to rolling this out. Give us your big vision. What is your really big vision? I heard that you also are going to launch mental health services. You want to invest in the latest technologies. Tell us a bit more about that really big vision that you hold.
Yes, so our big vision is to be able to scale our locations across the country and to open telehealth across the country nationally as well, because we want to bring this care model to everyone.
Yeah.
And so that's step one, but we know that there's so much to do. And so we want to create an ecosystem where patients and women can find solutions, have the education, the proper education they need. And so our plan is to build out content that's evidence-based with physicians and healthcare providers who are trained in menopause and sexual health and bring that content. And then long term, we'd also love to open an e-commerce shop as well to help women find the solutions that are over the counter. There are so many sexual health products and menopause products out there that are efficacious, that have evidence and data. And there's some that aren't so great, but it's really hard for women to understand which products are the best in class, which ones have data, which will truly help them. And so we have a lot of women coming to us with these products that maybe aren't so great and they're making claims that they can help with libido or they can help with desire or they can help with menopause. And then when they don't, they feel further broken. That this product was supposed to be the thing that helped me and it didn't. And so we really want to curate a shop with these brands that are have data behind them and are designed for women to really take care of them, to bring that to them as well. It's also hard to find the products because of advertising restrictions, unfortunately. And that's a whole other topic where, unfortunately, advertisers have restricted brands being able to advertise their products to women in the menopause and sexual health care space. And so we want to be able to bring that forward to offer more solutions and access.
Komel, I'm so inspired by you really revolutionizing this women's health space for making room to be heard, which I think is the basis of it all. And once you have the truth out, right, then it's easier to find solutions. And you found an incredible solution. I am so inspired by your story, and I'm so grateful for you for telling your story. My last question would be, what do you feel it takes to run a company like yours? What do you feel are your qualities that really serve you in scaling this business that you set up?
Yeah, so I'm a fairly emotional person in a good way. I feel the mission every day when I wake up, and I'm inspired to do so. And I often think back to the early days when we started a podcast and we talked to our patients, and our patients are so gracious that they were wanting to share their stories because at the end of the day, sharing our stories and storytelling is what unites us because we know that we're not in it alone.
Yeah.
And so when I was hearing their stories day in and day out, oftentimes I would cry alongside of them because it's just so profoundly difficult to hear story after story of dismissals and your own journey of 8 years of trying to find help for menopause,
Mm,
something that every woman, if we live to a certain age, we will go through.
yeah.
And so having that passion and that mission to bring it forward every day is really what keeps me going. And then I think, finding your mentors, finding those people that you can bounce ideas off of and talk to and get advice from is really important. And I work with a coach, and I'm proud to say that I work with an executive coach, and she's been with me. I've known her for over a decade. She's amazing. And she has been such an incredible help to me because you do go through highs and lows as a founder. It's not always amazing and wonderful. And so to help manage, every challenge, every opportunity, everything that you face working with a coach, I'm a very big proponent of because you need that support at the end of the day to take care of yourself through the founder's journey.
Komel, what do you feel is sort of the most important message about your story, why you're telling your story?
So I'm the parent of immigrants. And I always get emotional when I talk about my parents, but they came here with very little. And they came from Pakistan in the 70s and they moved to Cleveland, Ohio, and not New York, not LA. And my father was very different than many other fathers who immigrated from Pakistan. Not that it's not a wonderful place, but he told us every day, you girls can do anything and I want you to do everything. And he always gave us the education that we needed and wanted. And he was a big proponent of that. And so, wow, I'm getting so emotional, but I think it's important because, as immigrants coming into this country, giving their daughters the tools and the education to achieve their dreams and being supportive of that, I think it's important for many women to hear that no matter, where you come from, no matter your background, um, if you believe in something, if you believe in yourself, if you have people behind you that believe in you, you can really achieve, your wildest dreams. I never thought I would be able to do what I'm doing, but I do know that my father and my mother, who supported us along the way, gave us such a great support system. And he was the original entrepreneur in our family. And he did it with, alone. He came and immigrated here without his family and supported us so that we could do the same.
Komel, I'm so grateful. You're showing us a really big vision. You're showing us that ambition is a good thing to make this come true, that you can really disrupt a space that isn't the way it should be. And so, thank you so much for your time today.
Thank you.